Okay, hello. I think we're live. Now, everyone bear in mind, this is roughly our second time doing this. And so we're going to get better. I think if I might share this link right now with a few other people who I know were supposed to be here, but they maybe had an old link. So just give me a second here while I do that. But either way, I'll just give you a quick preview that today we're going to be going into just the change in pricing. Over the last quarter, the app became free. So I'm going to tell you more about that and our reasoning for doing that and what our plans are kind of moving forward to help support the app. Next, we're going to be talking about our new update for multi-user environment. So now you can do multiplayer in Med Valley. So that's great. Chances to learn together. We're going to talk about streaming. We're going to talk about how and the plans for future development. What's kind of the priority things that we're working on over the next few months to try and improve the application for you. So, okay, with that introduction, I'm going to quickly just share a link. I don't think you can see my screen, right? Okay, great. So everyone who knows now knows. They can watch later. Okay, terrific. Well, let's start off talking about pricing because if anyone's been following this, the Med Valley application was free a year or so back while it was still really new. Then we had a price for a little while, and that was a one-time price. And so many of you, I actually need to move this camera a little bit. It's bugging me. Again, I'm figuring this out. But many of you might know about, we introduced a price, it was fixed pricing, just one time. And that's because at the current stage of the app, it's in what's called the App Labs for Meta. So if there's kind of tiers for getting your app approved in the App Store. And so the App Lab is, not the bottom of the barrel, but it's right before the store. And the store is when it's publicly available. And with the store, we can have a subscription price on it, which I know to all of you, it's like, why would you want to charge us money? Well, we need to support the development of the app, right? So that's the reason for that. And a subscription is the best way to do that because of this type of content. You know that we need to be updating the cases. We need to be fixing bugs. It needs to be introducing new cases when new things come out. So it is best in that format. But essentially, you cannot do that before the store. And so we can charge a one-time fee. One of the challenges is, though, that the application still needs to grow a lot. And so we can't really put a price tag on it that's really high. So we've mostly had kind of low price tags on it that were one-time fee. And then you can't really support the application doing that. And we don't want to raise the price up to $150 right now, just because we want more people in it using the application, giving us feedback so that it's improving rather than kind of like asking a lot from you right now. It might be a choice we have to make, but at this current stage, that's not exactly the strategy we want to take. And so we decided to go for a free application for the next few months while we work on getting approval in the store. Approval in the store is quite hard for educational apps. On our last attempt, they said, hey, we're not really looking at educational apps right now. So write the Meta, complain about that if you want. But anyways, so that was part of the reason why we went from a paid application to a free application. And I'm saying this comment right now because someone reached out to us, rightfully so, and said, I think the quote was, I'm a little salty about this, that I paid for this application and now it's free. And, I really feel for that. I'm salty as well. So what we have promised those people that paid and now are kind of feeling miffed because the application's free is that when the application becomes paid again, because that is our goal, is that it becomes paid in the next few months. Essentially, at that stage, we will, and if I saw someone just join again, if you want to ask, if I'm asking the question you wanted to find out about and you want me to start over, I can do that. But essentially, those who already have paid will have lifetime access even when we switch to a subscription. Just for paying for us, supporting us early on, you'll have lifetime access for whatever that fee was, whether it was $10 or the $32 that we charged at one time. So whatever that is, you'll have lifetime access even when the application becomes paid for. And so I hope that's helpful. I feel it is. We appreciate your support regardless. It's just amazing to see people joining the application during the paid phase and now during the free phase. And the number of people who are signing up during the free phase is a lot more. So it's good. And hopefully we can get more feedback and build what you're wanting. Moving forward, though, so how is MedValley monetizing itself? How are we supporting our developers that are doing that? Is we are shifting over right now to a voluntary community benefit. And so if anyone's not aware, our website is medvalleyvr.com. And MedValley VR, you can go there and join with a community membership. We're trying to release more and more exclusive content. Right now, most of our content is public to kind of make people more aware, but more and more of that is going to be shifted to the exclusive portion of the website initially, and staying there to kind of support that community. Regardless of the amount of content, either way, those memberships go to support all the things that it takes. VR development is a beast. This isn't computer development where the GPUs and the capacities of the computers is so high that there's a lot of capability. It's quite a miracle what Meta's done, and it's pretty amazing what our team has done here at MedValley in producing realistic patients and putting them into the game. And so it's a lot of work and it needs supporting. And so if anyone hasn't checked it out, go and check out our community membership. Right now, the membership is $9.75, I believe. We're dropping that to $5 to try and get more people to come in, because we'd rather have more people supporting us at a lower cost and feeling like they're a part of it than fewer people at that higher price. A few people have just expressed that it's a little expensive for them given their situation as a student. So we respect that, and it would be great to have more come on board. And so that's how we're supporting the application right now. Anyway, so that stuff is kind of, the realities of building a VR development game that is very expensive development, very challenging development. Everything that we're doing is kind of custom and on the cutting edge. And so it's fun, but and as part of that, your support is really appreciated. Okay, so moving on, after that, pricing, just to let people know, another comment that we get often is, how do I use MedValley? Where are the tutorials? Yeah, thanks. So we do have a tutorial in the game, but it's quite limited. It really is. It doesn't really show you how to get the most out of MedValley. It shows you kind of how to do some basic interactions. We're upgrading that right now, but that takes more time to do that in the game. In the meantime, I have started to release a series of educational videos that describe how to use the app. And so these go over, getting access to it, how to interact in virtual reality, how to move around. Lots of you are new. I wonder in the comments here now or after if some people could mention whether they bought a headset because of MedValley or whether they already had a headset and then they found out about MedValley. My bet is that most of you got headsets as a result of MedValley. So that's great. That's terrific. But it means this is a steep learning curve for finding out about how to do things in virtual reality. I say steep, but like you're in medical school, so I think you can handle it. Or you're pre-med and you want to be there. But either way, this course, it has, I'm releasing a video today on multi-user environment, so I'll talk about that after, but multiplayer. So the course goes over, the course also goes through why we organize our cases in certain ways, and maybe I'll touch on that in a little bit. I plan on only taking about 40 to 45 minutes during this, but if I have time, I'll get to that. And so the course goes over those things. It's completely free. It's on the website. Go check it out. Share that. I know that there's a number of you who have reached out about this, and as the course has been developing, I've reached out to you for feedback, and thank you for any that have provided that. And hopefully we can make the course, make it easier for people once you get your headset to just hop in and make the most out of it. A few things that are in the course that I think are worth explaining right now. One is My Clinic. So when you go into MedValley, go check out our videos, but when you go into MedValley, essentially there's a number of doors. Each door is a different system of health, cardio, resp, neuro. Each of those have rooms with cases in them. At that point, you select the room, you go in and do a case. That's a traditional way of doing it. We added MyClinic to help people get around that a little bit and to make it easier. And what MyClinic does is it tracks your results across all of the rooms. And essentially what MyClinic does is it presents you then with the next patient that you're most likely to need. And so in MyClinic, you essentially go in and it's set up for cardio, resp, gastro. It has an order like that it takes you through, where it introduces cases to you throughout that. And then the cases you struggle with, it reintroduces those to you sooner. And so this is an example of using two learning principles that are really critical to me. One is mixed practice, and the other one is interleaving practice or spaced repetition. So interleaving or mixed practice, what that is it's when you are practicing a skill or a knowledge that you don't go block by block, but instead you take concepts and ideas that are somewhat disparate and you study them mixed with each other. You spend a little bit of time on one, a little bit of time on the other, and then you come back to them. Some of your medical programs actually reflect this, and they use a spiral curriculum where you are, for some reason when I do that, it really affects the lights, but I use a spiral curriculum where you'll touch on cardio, you'll move on to rest, come back to cardio and in more depth. And that's getting at that idea of spaced repetition or interleaving practice. There's two slightly different concepts, but they get at a similar idea, which is that it's better to compare and contrast ideas collectively. And the next point on that is that it's also better to space them out. By spacing out topics that you're studying, it forces you to forget some of that content, and it forces you to think harder to recall it. And in doing that, it reinforces learning and matures it. And so that's one of the first principles that MyClinic does a great job for. It's because it's kind of built into the process. So spaced repetition and mixed practice. I think those are the two principles, actually. And I think I just went over those pretty well. But so both of those are a part of MyClinic. And that's why we encourage people, when you're going into Med Valley, you can go to each of the rooms. That's a bit like cramming. If you need to study for cardio, go to that room. But if you're wanting to mature your clinical skills in general and you don't have an exam that weekend, MyClinic's the best place for you to interact with cases, to get first introduced to them, and then it's going to reintroduce them to you based on how much you've struggled or not struggled with it. The second topic that the course goes over, not in any particular order, but a second one that I think is worth explaining here, is why we've organized our cases in case groups. When you look in the application, it'll look like this. You'll be selecting cases and you'll see a symptom like breathlessness. Click on that. It'll open up to a subcategory of 5 or so cases. Rather than selecting each of the cases within there individually and practicing that particular skill, we recommend random within there. And so essentially what it's going to do is going to provide you with a spattering of cases that are all based on a similar symptom presentation. And the purpose for us organizing the cases in this way, and again, the whole part of stepping back for a second, one of the whole reasons and mentalities behind Med Valley is to take all of the learning principles that educational theory, cognitive science has developed over the last 100 years as we've been studying these types of questions. So it's to take those ideas and to build them into the framework of the game. And so that the onus for doing those is no longer on you, but the onus is on the software itself to get you to make those hard choices. They're kind of like forcing functions, if you've heard of that phrase. A forcing function is something that forces you to take particular action because it's part of the system, so you can't get around it. A lot of hospitals use that, where when you go to sign off on something, it will not let you do it unless you check something else. So that forcing function, like the limb check prior to surgery, there's ways that you introduce that as a forcing function to stop bad things from happening. We're trying to take forcing functions where typically you've had to decide, okay, I'm not going to reread the textbook today. Instead, I'm going to quiz myself with flashcards. That's a more effective studying habit than rereading. Well, you have to make that mental effort. You have to build the flashcards. That's kind of hard. So what we're trying to do is we're trying to instead make it a forcing function within the game, where if you just make the choice of studying the game, then learning principles and ideas are going to be already baked into the cake. It's going to be part of it, so that you just need to make the hard choice once to study, and hopefully we can make that fun for you. And then as a result of doing that, we'll take care of some of that learning theory and help make sure that you're learning in an effective way. So coming back to case groups, the point of why we suggest random is so that when you're being confronted with cases based on breathlessness, there's a bunch of cases in there, you've selected random, you don't know exactly what you're going to get. And as a result of that, you're going to encounter a number of different cases that are different, but all have this similarity of breathlessness. And that's going to cause you to, it's an effect known as the, well, it's interleaving practice, but I can't remember the exact name of it. If someone wants to write it in the comments and they remember it, but it's the effect that comes from when there's interference between particular ideas. So if I see one breathlessness patient who came in who was coughing and one breathlessness who came in who was not coughing, I start thinking they're both breathlessness. What's the difference? And that mental effort that it makes you take is really important for developing robust clinical frameworks and schemas to help you differentiate between things. When you just learn about the one type of breathlessness and you just hammer down on that and you know it really well, great, but it doesn't help you with the real world situation where you need to compare and contrast and differentiate. And so that's why we've organized case groups in that way. So when you're at the door, you're selecting breathlessness, chest pain, select random after that. And so that that randomness helps inform your clinical judgment. And that's, again, just one of the ways that we're building in some of our learning theory into the software. And so the course goes over those particular points, but also way more practical information than what I just shared there. Just like how to select those things and how to move, how to interact with the patient initially in VR, how to use teach, train, and test modes within VR. So just some practical things like that. So check it out. It's on the website now. And I think there's 2 more videos to be uploaded, but other than that, it's mostly done. Okay. So a big announcement that we have is that, and I see there's people watching. Does anyone want to share in the chat where people are from? I mean, I probably know who you are, but anyways, just share where you're from. Maybe it'll give it away if I know who you are, but that'd be nice. Okay, so the other big announcement we have is multi-user environment, otherwise known as multiplayer. So the point of this is so that you effectively can go in and study with, not alone in virtual reality, but with colleagues, otherwise known as friends. So that should be great. We've been having a lot of fun on our side, jumping into the multi-user environment with the development team and playing in there. And so it's really fun. It's a very new feature, so it's somewhat beta. The video will go over how to make that work. Some of the errors are on our side, but only a little bit. And more of the errors are kind of on Meta's side. And so, they're working through things. There's a lot of growth on their side, but it worked quite well. And so right now, what you're able to do is host a game and invite in friends. And so with that, you invite in friends. You can work on the same patient. You can talk to each other live during that, as long as you're on a call. And then the host can work through and do cases and get scored. And the other person can kind of quiz them and help them work through it. If you are wanting to switch who is taking turns, then switch who is host. Whoever the host is, it will judge that person for their scores, essentially, and have the output. At that point, so that's how multi-user kind of works. The course goes into more detail about how to actually do that. But it's really fun because I went through medical school at an interesting time where tools like osmosis.org were coming out, and or Past Medicine as an example. Some of those question banks were first starting to come out, and as a result of this, you could really learn lectures way more effectively. I remember my grades going up quite a bit when I started using some of those softwares. And one of the challenges, though, is that a really important part of medical school is who you're taking medical school with. And so while those softwares are great, it does kind of isolate people. It doesn't connect you to your peers. It doesn't connect you to great educators like you meet on the wards sometimes. And so we're really hoping that with virtual reality, we can reintroduce the social aspect while still keeping lots of the benefits of digital learning. With digital learning, there's so many things that you can do that you can't do in the real world. An insight I had once when I was in clinic where the doctor had to cancel. He had some patients cancel. He had to take some phone calls. There's nothing I could really do to help. And I was sitting there thinking and realized, oh, this clinic wasn't made for medical education. It was made for taking care of patients, which, makes complete sense. But I began imagining what a perfect clinic would look like and what would it look like if it were made for medical students. And, the digital allows you to do that, allows you to have a patient population that presents itself to you that's ideal for your learning, your stage of development. And that's part of why we're doing My Clinic the way we've done it, or why we do case groups that way, is so that it's a clinic made for you. But carrying that a step further is that we can also have a multi-user component to that. We can have multiple people in the same environment. I think we can get up to 8 in our multi-user environments right now. And so go on, connect, try and connect with friends. Something worth asking at this point for me is, we had one student ask about this. Is there a way we could begin connecting students with each other? Is there any interest in us doing that? So if you're on UK time and you study late, and maybe that's the ideal time for someone in the USA who's waking up and wants to practice their histories, is it possible for us to have a system that connects people like that? It is. We need to see if there's a little bit more demand for that. But if people are interested and they'd like to try and develop studying partners, then we could certainly facilitate something like that on our community benefits section and do anything we could to kind of make people available. It's a good environment. It has all of the regulations that Meta uses essentially. So you can friend and unfriend people, you can block people, you can mute people, you can do all of those things for kind of moderating your environment, making sure it's a good environment for learning. But essentially, that's new. That's just came out in our most recent app release. So it'd be great to hear some feedback on how that's working for people. We have a lot of fun when we do it. There are some limitations within it that we're aware of, like the person who's not the host can't interact with the patient and can't have that scored. So in the future, we'd probably like to make that a little bit more ideal, where you could toggle that on and off, or if you want that or don't want that. But for now, I think that's pretty good. Okay, so next thing I wanted to get to was, it just follows on from that. So now that we have got multi-user environments available, we want to start streaming basically bedside tutorials. So we have a relationship with a doctor in the UK named Dr. Brian Carson. And Dr. Carson is a big-time gamer. I bumped into him because he was actually trying to build a software somewhat similar to what we're doing too. And so when he saw kind of the progress we were making, he jumped on board and is cooperating. But he's essentially working to plan out a regularly occurring live streaming sessions that are basically bedside tutorials. So essentially, you're going to go on and ask questions live as he works through core clinical skills in virtual reality, explaining them as if we were at the bedside of a patient and he was teaching you about the ins and outs of assessing those types of conditions. Now, he's from the UK, so the content is somewhat more geared to the UK, but appendicitis is appendicitis. So we won't be getting too much into the complex management of a patient who's coming in and what category they are, how they should be treated. It's more like introductions to physical exams, introductions to science, introductions to clinical reasoning, and how to think through particular cases, that type of content. And so if at any point you want to recommend to us topics, please do, so that we can work through that and make sure that we're sharing what you want to hear. But for now, he'll be working through the MLA content map, which is a guideline and curriculum out of the UK that basically works through conditions and diseases, and he'll be doing presentations on those. And so that's really exciting. We're really thankful for him. He's a terrific asset, and I really hope that more of you get to know him as we start having those live streams. You'll see them posted on YouTube afterwards. So that's the live streams that'll be coming out, the pricing, the multi-user environment. That might be all that we want to share. Let me see. I think that might be it. I think we had some people hop off, and so I don't see any comments right now in the chat. And so the live streaming is coming up, so stay tuned for that. And please provide us any feedback. there was one more thing we wanted to touch on. It was the biggest update that we're trying to accomplish over the next few months, just to kind of let people know, because some of you go into the application, maybe your expectations are way up here. We're still a terrific app, I believe so, but maybe you're like, just the speech interactions. And if that's what you're thinking, yes, we are really wanting to improve the speech interactions over the next few months. It's going to take some work, but we'd like it to have just a smarter system for assessing your speech and the way you're interacting with the patient and the way the patient responds, so that history taking can become a more meaningful activity. Right now, it's a pretty basic when you walk through a history. As far as your interactions, you'll ask the questions, the patient will give the responses, and you can't dive much deeper than their responses. Well, I should say you can't dive any deeper than what they respond on that topic. But it would be great if you could say, okay, what statin are you on? Or how many steps do you have at home as you think about more complex management? And so that's where we'd like it to get to. And so that's one of the bigger updates that we're trying to accomplish over the next few months. So that'll make history taking easier, and that'll make patient interactions as you're changing the positions of the patient a lot easier. Now, bear in mind, we're one of the first apps, I believe, to have VR medical applications to have speech integrated. So it's a real feat that we have it right now, and it works fairly good, but we need to beef it up. And so that's one of the big adjustments that you can expect. Next on that, another end we're continually doing and working towards is an improvement of, or just adding interactions. Right now, we have about 140 unique clinical interactions in the game. So stethoscope on the back of the chest. That's one thing. Stethoscope on the front. Radial pulse, brachial pulse, carotid pulse. Those are all examples of unique clinical interactions. So right now we have 140 of them, and which is a great start. If you think about what you might do on a ward round or an ED rotation, it's tough to say if you do more than 140. But there are some ones that are missing that are pretty crucial that would be great. For example, power movements. We definitely need to add those so that that will open up a lot of neurological cases. We're adding brisk reflexes just over the next few weeks. And so we're always adding these interactions throughout. So that's another kind of big update for you to always look forward to, is that we'll be releasing more and more interactions. And if you want to prioritize them, joining as a membership and giving that feedback to us helps us know that we should definitely prioritize that. We're always releasing new cases. So last week we released 2 new ones in gastro, I believe. And over the next few weeks, we're releasing a few new neurological ones. I believe it was neurological, or it's RESP. Might be RESP, then neurological. But either way, those are on the way. So we're always trying to release about 2 new cases every 2 weeks. And so get on, check those out. Anytime you leave the app and come back in 2 weeks, there'll always be new content for you. And all that gets added into my clinic. So if you practice it, it will reintroduce that to you later on when some forgetting has had time to set in, and then you can relearn that. So those are the two large updates that we're working on, is the interactions and the speech. If there's anything else you want to suggest, we're all ears. It's part of the reason for why the application is free right now, is so that we can get as many people using the game and getting access to it and helping give us the feedback. So it's what you want for your medical training. But thanks for your time. I think we'll end here. But we're, again, starting to try and do these monthly. This is our second one, so we're going to do another one next month. No headset giveaways this month. We don't yet have enough members in the community membership. And so once we hit that 300, we'll start headset giveaways. So if you hear finding out about that, sorry I didn't mention that earlier, but we really want to start those giveaways. And so please share and get as many people in there as we can so we can get that process rolling. But look forward to talking to you next week. Please always reach out either through our emails or on the website. You can join our community membership and talk with us there. Cheers. Have a great night. Bye-bye.